Hi, my name is Paul Martin. I am the Chief Executive of LGBT Foundation, and it's my pleasure to host and share with my very good and old, in many ways, friend, Paul Fairweather, this edition of The Tip. We're going to be talking, they got us old queens together to reminisce on over 30 years of HIV in this country. So this session is going to be approximately 45 minutes. We're going to be in conversation with each other, asking each other questions. And this platform has been funded by the PASH Partnership through the Sexual Health Programme at LGBT Foundation. So it's my absolute pleasure to introduce my very dear friend, Paul Fairweather. Paul, do you want to say a little bit about yourself?
Sure. It's great to be here talking to Paul this evening. I've been involved in LGBT activism since the early 1970s, but I came to Manchester in 1978 to work for the Campaign for Homosexual Equality, CHE, which was then the main gay rights organisation in this country. And then in the 1980s, I worked for what was then Manchester Gay Centre, and then later on for the Manchester City Council as one of their gay men's equality officers. But also in 1985, I was one of 6 gay men who set up a Manchester AIDS line. So I've been involved in HIV since the earliest days of the epidemic. And for the last 4 years, I managed the Positive Speakers Project at George House Trust, where I work with a great group of volunteers, a wide range of people living with HIV. And we run training sessions for a whole range of people, talk about our experiences living with HIV and answer questions.
Thank you, Paul. And I probably should also kind of like talk a little bit about my pedigree and history as well. So I've not been involved in LGBT equality quite as long as Paul, but I moved to Manchester in 1989 and I got involved with the then Gay Centre and started a gay, and again, just a gay men's HIV safer sex and HIV prevention project called GreaterManchester, and that led to a full-time job for me working within gay men's sexual health, and for a while I worked for Manchester City Council. I think it was just after you were on the gay men's subcommittee, Paul, but just before you became a councillor. And so I've been in and around Manchester for over 30 odd years, man and boy, working for and on behalf of the LGBT communities. And from those very, very early days of Manchester, I've worked with a whole bunch of people to create and found what is now the LGBT Foundation, one of the largest LGBT service providers in the country, with a very, very active and like really good sexual health program that the TIP is just part of. So I think I'm going to start us off, Paul, and you kind of did start to kind of like identify, but what are your earliest memories of HIV?
Yeah, my earliest memories of HIV, I was working on a magazine called The Mancunian Gay, which is basically a collective produced by a group of gay men. And we regularly used to read the American gay press and magazines like The Advocate. And I began to read about this strange new disease then called GRID, gay-related immune deficiency, which was beginning to impact the lives of gay men, particularly in New York and San Francisco. And I think in about 1983, I wrote an article for Mancunian Gay, very much based on what was happening in America, saying there was this new disease. No one was really sure what it was or how it impacted. And then in 1984, when I was working at the Gay Centre, I organised a public meeting above the Thompson's Arms, and a guy called Tony Whitehead, who just got involved in the Terrence Higgins Trust, came and made this most prophetic speech about HIV and AIDS, how it was going to impact the whole community. And that really got me thinking about what was happening. I'd already had a good contact with some of the consultants at the old Monsell Hospital in North Manchester, the regional isolation hospital. And following that public meeting, myself and a group of 5 other gay men, mainly working around Manchester Lesbian and Gay Switchboard, set up Manchester AIDS Line as a 1-day-a-week telephone helpline. And that became the George House Trust, which still goes today. So basically, my first memories of finding out more about this disease and then beginning to talk about it more publicly, and then begin to offer basically an information telephone helpline, just operating a few hours a week on a Monday evening. So what about yourself? What's your first memory of the hearing about HIV and AIDS?
Well, I mean, coming out in sort of like, the late 80s, it was a pretty terrifying experience. In actual fact, in the early 90s, I wrote a user guide for a video that was produced by the then Health Education Authority called Scared Stiff or Cop Crazy, on the basis that I think that you came out one of two ways. You either came out thinking, sod this, I'm not going to pay any attention to it, and I'm just going to kind of go and have as much sex as I can, or you came out terrified and wrapped yourself in cling film and didn't want to have any kind of like physical contact and stuff. As I've been saying quite a lot recently, this is not our first pandemic as an LGBT community that we've had to live through. And if you cast your mind back all those years ago, Paul, there was a real terror of human to human physical contact, particularly between some gay men with other gay men. There was a real terror of just coming into contact with anybody. But so coming out in the late 80s was a very particular kind of experience. I came out at university. I joined the local gay soc, and we would regularly kind of like, come to Manchester's gay village and socialise in Manchester. But I guess you were very, very focused around supporting the members of the community that have become infected and affected by HIV. Because when I came to Manchester in 1989, there just wasn't any safer sex or prevention work anywhere to be found. In actual fact, there was very little prevention work that existed anywhere in the country. So my first memory of Manchester was coming into what was then the gay centre on Sydney Street, and sort of jumping up and down as sort of like, someone who, community student activist, was really shocked to find so little kind of activism on the scene. Because I think the energy and focus was very much about establishing Manchester AIDS Line. Because don't forget, Manchester AIDS Line didn't become George House Trust until the 90s. In the 80s, it was still very much a telephone support line that was, don't forget, it was also absolutely overrun as well by the number of terrified from the don't die of ignorance campaign that the government produced. I think several times, that the switchboard helpline nearly sort of like, melted down with people singing. So my earliest memories were very much about sort of like trying to generate some kind of community campaign on the commercial gay scene, getting access to condoms, getting access to safer sex information, getting access to resources from then the council, because the council was dealing with HIV. It seemed to be an environmental health condition, if you recall. So I think that that definitely there was a sense that lots of people socializing on the commercial gay scene didn't want to deal with the reality of what was happening to our community, and a lot of the venue owners and venue managers also didn't want to sort of like deal with the reality. So it was a lot of lobbying and persuading and trying to encourage people to take things seriously. And I think at that point, particularly in the late 80s, there was a real divergence between the care focused work. So what was the very early days of the Terrence Higgins Trust and setting up sort of like, the buddy scheme and supporting people that were dying really quickly because there wasn't hardly any medical intervention at all. And then the other side of it, which was very much about prevention and trying to get access to resources to prevent further transmission of HIV. So I think we were probably in different camps in some ways in those very, very early days.
Yeah, I think that's right, because I mean, we were overwhelmed by what we called the worried well then, which was people, heterosexual people, terrified of catching AIDS, fueled by all the sort of paranoia, but absolutely no risk. But then quite quickly, we had more and more people living with HIV, but being diagnosed as AIDS. This was before there was any treatment, there was no medication. So we were doing lots of buddying, we were supporting people formally and informally. I remember friends of mine, young, healthy gay men becoming ill, dying quite quickly, dying quite horrendous deaths, issues with hospitals and staff and undertakers and all sorts of people, lots of discrimination and stigma going around. So that very much absorbed our energies, I think, in the late 80s, early 90s, before we began to get AZT as the first treatment. So it was very much just a case. Also working with the council was very good at supporting, funding us, but also set up the AIDS unit, one of the few AIDS unit in the country. We had the first detailed policy, employment policy protecting people living with HIV. So there was a lot going on in terms of educating the health service. We did more training for social workers and for GPs, but that was very much the focus. And dealing with all the fear and the paranoia, the icebergs don't die of ignorance. I think it's easy to forget the level of fear and paranoia there was, not only amongst the general community, but amongst gay men as well. Gay men weren't going out, they weren't having sex, they were scared to touch people. We weren't sure about how it was transmitted. People thought it was by sniffing poppers. You know, it was really a level of fear about what you could do with anybody.
No, absolutely. And I think it's really important to remember those days and never really forget just the amount of prejudice and discrimination that existed. I mean, people living with HIV, I mean, that language didn't exist. You were an AIDS carrier, you know, you were afflicted. One of the biggest differences between the HIV pandemic and sort of like the coronavirus pandemic, I think, is about the language and the way in which the media are talking about people. You're not kind of like hearing criticism or blame being leveled at people that have become infected with COVID or the ways in which they've become infected with COVID. It's just accepted that some people have become infected with COVID and others haven't. Whereas actually back then, there was an absolute stigma and discrimination against people living with HIV, people that were gay men, people that were sex workers, people drug users, people from sub-Saharan Africa, all people and groups of people that are the target of the right-wing press. And actually the level of hatred, the level of prejudice, the level of discrimination was horrendous. And let's not forget that people that were hospitalized, because people were hospitalized very, very quickly, they were sort of like treated like pariahs. They had plastic screens sent around them. And like, you know, I mean, it was absolutely horrendous in the hospitals in the way in which people were sort of like stigmatized and treated. No one would touch anybody because there was a real absolute fear that just even being close to somebody would sort of like, you know, transmit the virus. And of course, that proved not to be the case. But, you know, I remember an early demonstration, probably one of the earliest times that I met you, was against one of those staff writers at the Manchester Evening News that sort of like, you know, had its shared an office, I think, didn't they, with the Daily Mail, and the Daily Mail's, I can't remember the name of the guy, his name. You've got a better memory than I, but there was a picket of the offices, the ones that were in Shambles Square, you know, behind where Marks and Spencer's is now, before the bomb. And sort of like, you know, the way in which these writers, these reporters were kind of, you know, reporting on HIV. It was just shocking, the lies that they were telling. And I remember that demonstration eventually ended up in developing, you know, good practice guidelines for the National Union of Journalists, and we managed to persuade them to adopt it again through sort of like, you know, the links and the connections in the Labour Party and in sort of the trade union movement. But you know, we were having to fight on every different level. Do you remember? It was just
absolutely, I mean, the guy I think it was Andrew Grimes, who was a really homophobic
Yeah,
writer.
that was a Manchester News guy, and I can't remember what the name of the guy from the Daily Mail was. I can't remember.
It's I know it will come to
Yeah,
me.
I'll come to
I know
you.
exactly what you mean. Yeah. But also there was very much the good and the bad people with AIDS. So it was children or haemophiliacs who were at no fault were the good people with AIDS, and it was gay men, drug addicts, African people, and it fed into all the racism and homophobia that was rampant then, really. So I think that's really important to remember that. And I remember visiting friends in hospital and just seeing that the catering staff would leave their food outside the door. They wouldn't come in. All the nurses and doctors were completely double bagged, when actually, you know, HIV is a really difficult virus to catch. You absolutely don't need that level of prevention. An ambulance, knew someone had HIV, stopped the ambulance, the health authority quarantined the ambulance, they wouldn't use it. It was like the level of
Undertakers not taking bodies away.
Yeah.
Do you not remember?
Yeah, funeral directors wouldn't take bodies away. It was a really difficult time.
So I think that, you know, setting that, you know, historical context, the level of hysteria that existed then was phenomenal. And again, you know, there are really, really interesting parallels with what we are experiencing right now. But of course, irrespective of what we might think about what the government are doing or not doing, there is definitely a no holds barred kind of like, you know, tsunami of investment into kind of coping with COVID. Whereas actually there was diddly squat coming in for HIV. There was just no support at all. And we had to fight, because of course my first boss was Hugh Polehampton.
Yeah, of course.
And Hugh was very senior in the council back in the day. I mean, he was an assistant town clerk, which is now the equivalent of deputy chief exec. So me being kind of quite a lowly council officer, being line managed by like the equivalent of the deputy chief exec, I mean, it was quite extraordinary, really. But Hugh was amazing. And, you know, for many years, Manchester City Council got the largest single grant in the AIDS support grant from the government than any other local authority across the country. And that was mainly down to Hugh and his tenacity and his passion and his perseverance. But yeah, I mean, the community response was amazing when you think about it. But we had to create, you know, campaign groups. We had to create activism groups. So I'm thinking about, you know, ACT UP, which we were both involved in. So I wonder what your early memories of kind of ACT UP in Manchester were, and why it was so important to have it.
I think it was incredibly important, and we learned very quickly from the activists in the States. At that time, Reagan wouldn't mention HIV at all. The drugs were refusing to fast-track drugs treatment. So we absolutely needed that form of direct action. And I mean, I came out at the tail end of the Gay Liberation Front in the early 70s. So for me, I got a track record of doing gay activism, was involved in Gay Activist Alliance in the late 70s in Manchester. So, you know, activities like disrupting James Anderton, who talked about gay men swirling in a cesspit of their own making. We actually sort of dressed up and posed as evangelical Christians, unfurled a banner in imitation of suffragettes, had Bibles thrown us. So that level of activism, you know, throwing condoms over the wall at Strangeways, just lobbying and picketing everything that moved, was really important to get the resources, but also to change the political agenda, which was refusing to talk about HIV in any meaningful way at all.
Yeah. I mean, there were some amazing people, and we did a series of interviews that are on our website if people want to see them, about sort of like the last 30 years of kind of like, you know, living with HIV in this city, and like, you know, I think we called it Sex Talk, because we were particularly interested in people's remembrances and recollections about how they lived through the epidemic, how they survived the epidemic, and how they continue to sort of like celebrate their sexuality and stuff. So I would advise sort of, you know, listeners to like go and have a bit of explore on our website and have a look for Sex Talk and look at those videos, because it's amazing stories. And I think particularly some of the, you know, pioneers of ACT UP. I mean, whilst I was involved in ACT UP, I would never claim credit for, you know, running it. There were other people that were much more involved in me. Andy Gardner, Dick London, others that were sort of like, you know, the leading lights of kind of ACT UP Manchester. And, you know, I mean, you know, people with, you know, kind of quite serious jobs that sort of like put themselves on the line because, you know, the agitation often sort of like, you know, run the risk of people being arrested. And it was a direct action kind of group and stuff. And I think that ACT UP Manchester really played an important role in keeping both the city council, which was supportive, and the health authorities, which did their best, but it really played an important role in keeping them honest and keeping them, you know, true to their words and true to their commitment. Whilst there were definitely, you know, a small cadre of people within the council that was sort of like, you know, gay or queer positive and sort of like were really supportive, there were plenty of councillors that weren't. Plenty of people that, you know, were sort of like, you know, would have let things slide had the fear of ACT UP not picketing their offices or picketing their meetings, not kind of kept them honest. So big shout out to all of the activists that played an important part in ACT UP Manchester in probably the early to mid 90s, I think. It probably.
Yes, definitely,
So let's move ourselves a little bit forward. I mean, you mentioned about AZT. You mentioned about when suddenly kind of like clinical opportunities came along, and also about sort of like, you know, where we suddenly were in a situation where, you know, getting HIV didn't automatically mean that you were dying, but actually there were some treatment options. So again, you know, share your reflections about AZT and other drugs coming in.
I mean, for me, one of the most tragic things is I had a number of really close friends who sort of were just at the cusp, and actually, if they'd lived another 6 months, they might have been able to go into AZT. So they actually died just before the first drugs came in, and that's always a tragic thing, really. I had quite a few friends on AZT which was really toxic, and they just couldn't take it. It made them iller. So they either unfortunately died or they kept going until the drugs changed, really. But for example, I was diagnosed in 2000, and actually when I was first diagnosed, I went on medication straight away. And I used to take 16 tablets a day, some at night, some in the evening, some with food, some without food. It was a whole cocktail of different drugs, but it was that combination. It was the 3 different types of medication that attacked the virus in different ways, made a huge difference. But it was still a lot of different type of drugs to take. Some of them were still quite toxic. And now over the last 20 years, it's proved enormously. I now take 1 tablet a day. I have no side effects. I see my consultant every 6 months. So there's been a huge improvement in the medical treatment and a big improvement in terms of attitude. But I think there's still real examples of stigma and self-stigma that still mean, even today, that the treatments are so much better, that some people living with HIV are isolated, discriminated against. There's still lots of issues that you wouldn't, as you said before, that doesn't relate to COVID. People with COVID will not get the same level of discrimination or stigma that people living with HIV still get. And it's really clear the U equals U message, the undetectable equals untransmittable. So absolutely, if you've got an undetectable viral load, like I've had for many years, we cannot transmit the virus. We are the safest person in terms of transmission. So that message still needs to get out to many, many more people.
I agree with you, and I mean, I think that certainly from, you know, my recollection of those days, I mean, I had a friend who was, let's just say, a total party animal, and he availed himself of a whole range of different pills and powders that kind of like were on the gay scene at that time. But tragically, the one tablet that would have saved his life, AZT, he was horrendously allergic to, and he had the worst reaction to it. And at that time, AZT was the only drug that was available and stuff. And so he died, and again, probably just a couple of months too early, before he was able to kind of benefit from the next sort of like, you know, generation of drugs that came on. So being allergic to the only drug that would keep him alive was just like the worst sort of like, you know, situation to kind of get ourselves and ourselves in. But again, the stigma, you know, of that, you know, a good Irish lad, you know, parents and family didn't know he was HIV. I'm trying to explain to the mother on the day that he died what was going on, but he was whisked away back to Ireland. You know, yes, his friends were able to kind of like go there, but there was no mention of sort of like HIV, there was no mention of what was going on. In actual fact, you know, what sort of like, you know, the vicar said was it was liver cancer, and that's what everybody was kind of told and stuff, because the family couldn't cope with the shame and the stigma of being HIV and stuff. And I think that, you know, you're absolutely right. It still casts a very, very, very long shadow even now. You know, I know plenty of people who don't want to be out about their HIV status because of employers or because of families or because of just the fear of being sort of like, you know, stigmatized and isolated if you're not in contact with certain communities. I think some of us, you know, are really okay and really comfortable with sort of like having lots of friends and lovers who are positive, but there are plenty of people still in our community that will still shun you. You know, there's still plenty of people on the apps that, you know, will sort of like, you know, look for people that are not infected with HIV or talk about being, you know, disease-free. There's still a lot of stigma out there and a lot of shame and a lot of internalized shame, I think, that many people kind of carry with them to this day. So there's still a lot of work to be done, and I think that people can forget too quickly because there are much better treatment options available for people, thankfully, but that people still die of HIV, and particularly people that, you know, might be, you know, diagnosed quite late on or might not have sort of the same kind of treatment options available to them. So you jumped ahead quite a bit. I want to take us back a little bit to, you know, sort of, you know, the probably the very late 90s, the very early 2000s. And you said that was when you became infected with HIV. I also know that was particularly difficult and challenging times for us as an organisation. We were then Healthy Gay Manchester, that then became the Lesbian and Gay Foundation in 2000. But there were massive debates going on about whether HIV was a generic illness or whether it was a gay illness, and there was sort of like a de-gaying AIDS and then a re-gaying AIDS kind of thing going on. So some people felt that in order to kind of get the resources and in order to kind of get the support from politicians and funders and policymakers, we needed to make HIV a disease that was perceived to be affecting everybody. And then there were another form of activists that sort of like felt very strongly that in actual fact it should be really targeted on the communities that were most at risk, and that actually that there was a piece of work that needed to be destigmatizing the fact that public money should be allocated to gay people, drug users, drug users, and prostitutes in particular. So what are your recollections then? Because that was probably, was that round about when you were joining the council, or was that just still a bit early in?
I became a councillor in 2003, so it's a bit before that, but we're still very much involved in all the debates, what's going on in terms of like what was happening at GHT as well, really. And I think it's really clear about recognising that why it does affect the whole community, and that's really important. That still it's gay and bisexual men, heterosexual men who are still very much at risk, and we face particular stigma and discrimination still. So by the late 1990s, there was still, you know, lots of discrimination in terms of employment and services. There wasn't gay marriage. There was all sorts of things that we didn't have. So I think it's important to remember that and actually think about what we were doing in terms of, you know, the city council was still struggling in terms of getting some of those things sort of sorted out, really. I think GHT has historically always had a wide range of people, but gay men have very much been at the heart of the organisation, really.
Yeah. I think from my perspective, it was always about gay and bi men, because, you know, first of all, it was MESMAC Manchester, which stood for Men Who Have Sex with Men Action in the Community. Then it became Healthy Gay Manchester because we thought that was a bit more inclusive, and then it became Lesbian and Gay Foundation. So the focus for us was always about, you know, gay and bi men from our perspective, and we partnered with GHT, and we partnered with Black Health Agency, we partnered with MASH, which is the sexual health program for street sex workers. So we partnered with organizations that were doing targeted work with other communities of identity. But for us, it was always about gay and bi men. And, you know, I remember the challenges in the late 90s in Manchester about getting people to be inclusive of bi men. You know, there was a huge amount of biphobia that kind of existed, and lots of discrimination that was sort of, you know, experienced. So we came along, new kid on the block, and sort of like, you know, we were interested in gay men and bi men and men who have sex with men, and we upset the apple cart quite considerably. And of course, you know, that's when you saw some quite totemic services being developed, you know, the condom and lube distribution scheme that celebrated its 25th anniversary last year. The magazine, it was out in Greater Manchester, it then became out in the West. But even before that, you see, it was Between the Sheets, our very first publication. And in the late 90s and early 80s, late 90s, early 2000s, we produced huge amount of information, huge amount of printed information, you know, hundreds and hundreds of thousands of leaflets and postcards and posters during that time that we distributed all across the commercial gay scene. And we were always struggling about the language that we used, and we were struggling about the images that we could use. Could we show an erect cock? Could we show a cock at all? You know, were we allowed to use the word fucking? I mean, I'm using this language now in the hope that my colleagues in the sexual health team will be quite relaxed about me using this language and stuff. But one of the first resources that I wrote was called Fucking Alternatives. And I remember that there was an exhibition at the town hall in the sculpture where in order to sort of like display our wares, we were kind of like wrapped in black tarpaulin with our over 18 sort of like sign on the outside. We had the biggest queue because actually inadvertently council officers had actually created a real buzz about our stall. I mean, it was just an ordinary stall that you would get at a normal conference, because our resource had, you know, was called Fucking Alternatives, and because it was a sort of like, you know, a seductive looking man, sort of like only from the waist upwards, sort of like with his top off, people felt that was deemed to be, you know, adult material and needed to be kind of like given a over 18 only kind of rating. So, you know, there was a lot of sensitivity still, but we produced huge amounts of resources.
And I think those resources outside Manchester were really important, because in lots of smaller places, there was very little support. People were coming to organisations in the centre of Manchester. I think out northwest, which I wrote an opinion column for years and years, was really way of getting discussion and debate and information across to loads of people. This is pre the internet, this is pre-mobile phones. It was still really difficult to get the information out to people and encourage people to come and ask for support. Really. So I think that was crucial, that volume of stuff, just keep churning out for people. It was really important.
Absolutely. I mean, we were one of the first charities. Well, for starters, we really struggled to register Healthy Gay Manchester as a charity. Because the Charity Commission wouldn't accept gay men's sexual health as a charitable issue, and so we had to fight them tooth and nail. And it took us a couple of years to get charity status. It was even before that, we couldn't get a bank account. We had to go and find a gay banker who would sort of like, you know, personally supervise and sort of like, you know, manage our money, because, you know, a number of banks refused to. I mean, it's really interesting now that the banks are some of the most progressive corporate organizations in terms of LGBT inclusion, but back in the mid 90s, we wouldn't even open a bank a gay men's organization. And of course, we were one of the first organizations that had a website. And I remember putting in a bid to our commissioner at the time for £1,500 to buy an Apple Macintosh, classic Apple Macintosh computer that you know operated with floppy disks and a laser printer, so that we could produce information, like leaflets that we could just do in the office and just whiz off on the laser printer. And it was £1,500. I remember being pleased as punch of getting a 20% educational institution discount. At the time. Our commissioner went bonkers because that was at the time when actually places like the Health Authority and the town hall, they had the typing pools. So actually, when I first started working at Manchester City Council, I'd have to write a letter out that I wanted posted. It would go to the typing pool, be typed out on a flimsy. I'd come back and I'd correct it, and then it would go back, be typed up on letterhead, and then sent back to me for my signature. Woe betide you, woe betide you, sort of like typing your own letters. That was absolutely,
I meant completely. Yeah, it was like that when I was
being a lowly kind of junior officer. If the director wanted a mail out, which invariably he did, you would be bumped all the time. So it could quite easily take a week for me to respond to a letter that somebody had written. And people have no idea. I mean, the inboxes and stuff. I mean, the way in which the internet now works, and sort of the emails are constant all despair in sort of modern society. But it was completely different environment, and I think that was influenced by sort of the way in which we distributed and disseminated information. I mean, I think sometimes we were able to do it much more clearer and much more directly, getting it into people's hands. But of course, you had to be in and around the commercial gay scene or other distributing to. So the benefit of social media these days is you can get out to a much wider kind of group of people. So if you wouldn't mind, I'm just going to ask you a personal question, if you like. So I'm going to ask you to cast your mind back to 2000 when you were diagnosed. And just sort of just share with our listeners what that kind of felt like at that time. Because I think it was still different then than it is kind of now. I mean, we will move forward a little bit in a second, but I just thought that you've spoken very eloquently, you've written very eloquently about your experiences of living with HIV. And I think that as a very prominent queer activist, as well as sort of at the time a prominent politician, it took a lot of bravery. I mean, I remember the time and date you came out HIV. I remember that very vividly. But what were your kind of your recollections from that time, from that moment?
I mean, for me, I was really, really surprised that I was HIV positive. I'd never had an HIV test. I've been very, very aware of HIV from the early 80s, and I'd always had really, really safe sex. I was completely confident I would never be HIV positive, so I never had a test. And I was quite ill, and actually, so when I had the test, it was a real shock. My viral load was 750,000, was very high. My CD4 count was under 200, so I started on medication straight away. And whilst I didn't think I was going to die, I thought my life would never be the same again. And actually, the irony is that my life since then has been, the best. My 50s has been amazing. I mean, mainly because I've been dancing Argentinian tango for the last 10 years, which has completely transformed my life and my expectations. So actually, my 50s have been wonderful, really. And I then went on the cancer in 2003. But I think for me at the time, I didn't tell my mother because actually she was in her 80s. She was quite elderly. She probably would have been fine. But actually, on balance, I didn't think I needed to tell her. So it was only after she died in 2007 that I actually began to be more public. And I think coming out for me at the vigil at Manchester Pride in 2009 was really significant, was really important. It attracted far more publicity than I thought it would, to be honest. I didn't think there'd be that much interest, but it was live on Radio Manchester. There was a huge photograph on the North Manchester Advertiser, which where I live and where I was a councillor, saying local council said HIV positive. But I have to say the people in Harper Hay, where I was a councillor, were very supportive, were just very down to earth with me, really. And I think for me, it actually was a very positive experience. And I think it made me think that sometimes it's your own fear in the head, whether it's coming out about your sexuality or your HIV status, that can somehow actually stop you doing that, really. So I think I now feel I have the confidence to actually be open when I want to, and I don't have to be as well. I can decide I want to come out. But again, I got a very positive response from people at the vigil, from the community, from wider really. And I know for some people who are living with HIV who weren't able to come out then, I think it had quite an impact on them. So I know it's encouraged other people to come out more publicly, which is great, really.
No, I mean, I think it was remarkably significant, and I think that, you know, I mean, obviously as friends, I knew before you came out and stuff. So you know, we've had this conversation, you know, many times, and you know, some of the private elements of it and stuff. But I think you being really open and honest about you know, your HIV status and living with HIV, you know, has been really, really important. But I think it's really interesting in terms of how things have changed. So 2003, when you were diagnosed, sort of like, you know, in hospital, whereas now you can get onto our website and you can order a home HIV testing kit, and you can test yourself for HIV in the sort of like the comfort and privacy of your own home, and you can have much more control of your own kind of journey. And I would encourage all of our listeners to kind of look on our website for the home HIV testing kit, if that is where you are in your lives and stuff. You know, we can definitely support you on your journey. But the difference in terms of emotionally what people went through. I mean, I remember people being terrified. I'm not saying that people are not still frightened. People still get very frightened from like, you know, self-testing. Of course they do. But actually just the difference of, you know, people giving false names. I mean, you know, the sexual health clinics probably, you know, they probably tested more Armistead Maupins, more, you know, Michael Cashmans, more, you know, sort of like, you know, other kind of like, you know, famous gay celebrities than anything else. Got to give a name in a sexual health clinic, but it's not necessarily disclosable. But I think what's really, really interesting is that how we have significantly moved on from those days to now in terms of being able to sort of like, you know, as I say, test it at home. And similarly, you know, with our condom and lube distribution scheme, I mean, you mentioned about, you know, personally being surprised about your diagnosis. I think it's really important to kind of remember, even in, you know, sort of like more modern times where, you know, PrEP is much more freely accessible and available, and U equals U, the condoms still play an important role, and we still provide, you know, condoms by post. And again, listeners can find out details about our postal condom and lube distribution scheme on our website. But let's, in the final moments of this conversation, because believe it or believe it not, 40 minutes have passed.
Oh, wow, really good.
But let's just bring ourselves up to the modern day. I mean, you've mentioned U equals U. Manchester is part of the Fast Track City network. We are looking to sort of like end HIV in a generation. There's a lot of work that's gone into sort of like, you know, reducing the incidence of HIV figures amongst sex between, you know, people. And I think this pandemic has also significantly had a big impact. Whilst I'm aware that people are still having sex and the apps are still, you know, sort of like, you know, generating a slow but steady trade, as I understand. But definitely, you know, we are seeing even further falls about HIV transmission. What do you think the future holds, Paul? Where do you think? So with these amazing sort of like, you know, improvements in both treatment and sort of like, you know, self-management opportunities, and particularly trying to get as many people diagnosed as we can to get them on treatment to bring their viral load down to undetectable levels. What do you think the future kind of holds?
I think it's very possible that we can eliminate all new cases by 2030. I think the combination of U equals U, that everyone, as soon as they're diagnosed, is put on medication straight away, whereas in the past you might have waited years before you start taking tablets, to make everyone as undetectable as soon as possible. I think more and more people being on PrEP and aware of PrEP and how to use PrEP, I think that's very possible. there will be some people who cannot be undetectable. I think we need to be clearly aware of that, and that's maybe an issue. So it's not no one's fault if you cannot, or everyone can be undetectable. It might slip, but I think it's really important. That's going to be an important message, and I'm hoping that the sort of stigma and the self-stigma will still slowly change. I think the U equals U message, the more people understand that actually the reality is if you're living with HIV and undetectable, you're the safest person to have sex with, basically, and people need to be aware of that much more clearly. And I'm hoping, I mean, we've done a lot of work in the last 3 or 4 years, talking to young people in schools in Manchester, whole year groups, talking about living with HIV. And I think it's their willingness to answer questions, their awareness, their understanding is the future, really. If we have a whole generation of young people who've met someone living with HIV, who know about how it's called and how it isn't, and aware of stigma, I think that gives us, I mean, lots of hope for the future, certainly in Manchester, that we can have a situation where there will be no new cases and people's attitude will continue to change and improve. People will be much, much more aware of the reality of living with HIV in 2021.
Yeah, I mean, I equally share your optimism. I mean, I think that there has been tremendous sort of like strides forward, particularly in recent years, and particularly with sort of like, seeing just how successful, PrEP has been and can be. And we've got a clear route out of the HIV epidemic, certainly in this country, with sort of like, the recommendations contained within the HIV Commission that we have been kind of like, connected with. So I think that there's some amazing advancements, some amazing strides forward, and really clear and understandable and achievable sort of like, next steps. My fear is that we've seen a significant disinvestment in public health services generally, and HIV services specifically. We are seeing sort of like sexual health clinics being having their budgets cut. We're seeing HIV prevention and sexual health prevention services having their budgets cut. And I think that what is inevitably going to happen is that as we come out of this lockdown, as we come out of social isolation, we only have to cast our mind back where, the population has been managed tightly before, after wars, for example. The explosion of sort of like, partying, the explosion in sort of like, the pregnancy rate, the explosion in terms of other sexually infected diseases at that, back in the 40s and 50s. I think that what worries me is that as we kind of like go, I mean, I've been reading some articles recently about what the new roaring 20s will look like in the next kind of couple of years. I worry that the disinvestment that's taking place now will leave support services unstable to kind of like support that, and that we will see an explosion, and that we'll see further disinvestment in things like PrEP and sexual health clinics and sort of like prevention programs, because at the very time we must kind of like put the foot on the accelerator, I worry that actually investment will be redirected elsewhere. So that's my concern, the really hard work of activists and colleagues who have put in the time and energy to create the solutions, that will just be ignored or swept aside in the sort of like sort of like changes that are inevitably going to take place as we start to pay for the true costs of this pandemic. So a bittersweet sort of like place to leave it on. But Paul, it's been absolutely fantastic to have this conversation with you. I really, really have enjoyed, as I always do, spending time with you. It is an effortless conversation. I hope that our listeners have also enjoyed this conversation. Maybe, you never know, they might ask us to come back. Two old queens reflecting on the past. How about it? The new podcast, you've seen it. I
mean, for me, it's been great to catch up with you, but also like I think between us, we cover an enormous range of like LGBT and HIV history in Manchester. I think it's important that we don't forget the activists who came before us. We don't forget those people who died of AIDS, and actually all the work that was done but an enormous range of people. I think it's really important to remember them as we go forward, really.
Absolutely, and it's not true that every queer activist in Manchester needs to be called Paul. Which it happens, a couple of us have been. Yeah. But I think that you're right, and I mean we as always stand on the shoulders of giants, and you know, it's our job to sort of like, you know, support and lift up the activists and campaigners who are following it. And things have changed massively. I mean, our sexual health program, I've talked a lot about gay and bi men because that was my experience and the work that I did when I was working on the sexual health program. But of course, our sexual health program now is fully inclusive. It's fully inclusive of the needs of lesbian and bi women. It's fully inclusive of the needs of trans and non-binary people. And so it should be. And the advice that we kind of give and the services might have been adjusted accordingly. Of course, there's so much that we haven't said, and there are many things we haven't shared. So between us, we know where quite a few of but it's been a real pleasure, Paul, and thank you so much for being part of this special edition of The Tip. As I said, you never know, we might come back. Maybe it's a shame that we couldn't get this to work and make it live so that we could be getting questions from you. Maybe for the next time. But The Tip has been brought to you by the PASH Partnership, which is part of the sexual health team at LGBT Foundation, and more information can be found on some of the services that I've mentioned, including condoms by post and the HIV home testing kits on our website. So thank you very much. Hope you've enjoyed it, and stay safe.